So let's talk about something I get asked all the time, which is if you don't have a gallbladder anymore, or if you have gallbladder problems, can you still take a GLP-1? I'm Tiffany. I'm a physician assistant, but also a GLP-1 advocate. So I help people get access to GLP-1s that can't get them through their insurance. So if that's something you're struggling with, there is a link over here in my bio that hopefully will help you out. So I don't think it's any secret that GLP-1s slow down your digestive tract. So they can affect gallbladders or the lack thereof. Now, a lot of folks come to me and they don't have a gallbladder anymore and they have a lot of issues with diarrhea. So sometimes slowing down of the GI tract is not always a bad thing, but people have heard some misinformation that they can't take GLP-1s, and I want to clear that up for you. Your gallbladder's job is to hold bile. Bile comes from the liver, sits in your gallbladder for a little bit, and then eventually goes into your bowel. If you don't have a gallbladder anymore, then the bile goes straight from your liver through the duct into your bowel. Now, when we slow down digestion with a GLP-1, it actually slows down the flow of that bile. So it does put you at a little bit of an increased risk of developing stones or sludge in that bile. So imagine if a river just didn't flow quite as fast, it could get a little bit murky. And that kind of is what happens with the bile and bile ducts. Now, looking at some studies, it does show that GLP-1s do increase the risk of gallbladder-related events about 25% in people. But it depends on the dose that you're on and also the length of time that you've been on the medication. One really large study showed that 1 in 67 people developed gallstones that were taking a GLP-1 when you compare that to 1 in 100 people who were not taking a GLP-1. So the risk is definitely there. Now, weight loss in general can put you for a little bit of an increased risk for developing stones, not just GLP-1 related, but the quicker you lose weight, the more likely you are to develop these stones. So what if you don't even have a gallbladder anymore? So you can still take a GLP-1. It does not automatically disqualify you, but the risk of stones can still exist. You can still develop stones in the bile duct itself. You can also get a somewhat rare condition called sphincter of Oddi dysfunction, which is a very painful spasming of the bile duct. Okay, so what to watch for? So if you're having trouble being able to tolerate a fatty meal, that's a little bit of a problem. If you're having right upper quadrant pain, that right where your gallbladder is or was, that can also be a sign something's not right. Or if you're having nausea and vomiting that you're having trouble getting control of, you need to see your provider. This one's kind of rare, but any yellow color to the skin or the eyes is always cause for concern. You need to get seen right away. So as a provider, if I know somebody has gallbladder disease, there are a couple of things that I do to try to help that patient not have issues. One is I keep their dose low and slow just to try to reduce the fast weight loss, because when you don't lose weight so fast, it helps with not creating those stones. So low and slow is the key. I try to tell people to eat plenty of healthy fats and make sure they're staying hydrated, because that also helps prevent stone formation. So all in all, just because you have gallbladder issues or you don't have a gallbladder does not mean that you're not a candidate for a GLP-1. You may just need a more personalized approach to your therapy. So this class of medicines is still an option for many people. You just might need your approach tailored to you personally. So let me know what questions you have, if you've had issues, if you've had a gallbladder, not had a gallbladder, and I want to know that in the comments. Just let me know what you think.